Welcome to our neurosurgery program at the University of Vermont. My name is Dr. Bruce Tranmer. I'm Chief of Neurosurgery, and I'd like to tell you a little bit about our neurosurgery residency program here. I believe that we have a very special residency program for a number of reasons. First of all, we have a one resident per year program, and this fosters a strong mentoring relationship between our faculty and the residents. We are also the only neurosurgery tertiary care center and the only level 1 trauma center in Vermont, and we service most of Vermont and northern New York. We also have this wonderful hospital where we get to take care of our patients, and finally we get to work and play in one of the most beautiful areas of the country. I've now asked my neurosurgery colleagues and my neurosurgery residents to also tell you about our program.
So I chose the UVM program after having the opportunity to do a rotation here as a medical student, and really just enjoying that experience. I got along really well with the residents, and I could tell right away that the faculty here were great, and it was the kind of place that I wanted to train.
And I like the camaraderie between the residents. I like the individual attention that the attendings gave, and I like the autonomy that it provided for the residents.
Being a small program, we're able to have a close relationship with each other as residents and also with the attendings. When I first met them, they were all extremely welcoming and personable. They care about me as a person and about my family, and it's really a tight-knit group that works together well as a team in taking care of our patients here.
I try to be in the OR as much as I can, but I would say a couple of times a week I get in and get to do stuff, so that's fun for me.
As a fourth-year resident, you're a more senior resident, and so there is graduated autonomy in the program. The advantage is that you get to first assist the attending during the case. You get to do a little bit more of the critical portion of the case.
The residents are given gradual responsibility in the OR within a framework of solid mentoring directly with the attendings. We're there for every case, allowing as much responsibility as we can, tailored to that individual resident. Even as chief resident, they're not operating without our assistance. We feel that this system serves them well and serves our patients well.
Cases that become routine offer something to learn, and the attendings are really good about pointing out nuances that really help cultivate the entire experience.
Being a one resident per year neurosurgery program, the attendings and the residents do work very closely together. For example, in the operating room, it's a one-on-one experience where we depend on each other to work through the case from start to finish.
I love having the residents in the OR. They start off and they need a lot of guidance and assistance and ultimately grow into being my partner. The senior residents function at a high level, and I don't really consider them trainees at some point. I consider them equal partners and part of the team.
I operate almost every day. There's a wide variety of cases. Last week we clipped 2 aneurysms. We do peripheral nerve, we do spine, many tumors. I feel like we have the full breadth of neurosurgery cases here at our program.
The advantage of UVM is that we have the Donaghy Skull Base Lab, and the unique addition that it provides to our education is that it allows for an opportunity to go in and practice dissection, practice wound opening and closures, and also get a sense for surgical anatomy.
In the Donaghy Skull Base Lab, we will have scheduled didactic time throughout the year. So we'll do dissections in the lab that'll cover various topics in neurosurgery. And we'll do things ranging from skull base approaches to spinal instrumentation to peripheral nerve, basically spanning the entire topic of neurosurgery. In the Donaghy lab, we've got basically a full set of Zeiss microscopes for microsuturing or microdissection. That's available to use. We also have full endoscopic sets, so we do endoscopic approaches to the skull base and have full sets to do dissection for practice or for research projects or really anything that the residents would be interested in.
We can schedule our own time in the lab to do a dissection of any kind, anything we want to brush up on. So just last week I did a total spine dissection from the cervical spine to the sacrum, and that really has helped me a lot in the OR.
They have a lot of resources to be able to practice even basics like suturing. They have a dissection microscope over there. So that's a nice opportunity when you can get over there to be able to practice those things.
And then on top of that, the ability to have the skull base course that we do annually is also really rewarding. We bring in people from other institutions who are really experts in their field. So it's valuable in that sense too.
So I think that camaraderie here at UVM is probably the hallmark of our program. I think that we have a culture here of always being available and supportive of one another. There's never been a time where I haven't felt like I can just directly call or text an attending for assistance with patient care.
That's probably the biggest selling point about this place is the interaction and the atmosphere that exists between the attendings, between the residents and the attendings in neurosurgery, and then just across the whole hospital. It's very collegial to the point that our relationship with the attendings, especially as you progress as a resident, once you get to a chief resident level, they really treat you more like a peer.
Being a smaller program, we can focus a lot of individual attention on the residents, and we get to know each other very well, and can really help to foster improving surgical skill throughout the residency program.
Over the course of 7 years, we all become very good friends. You'll know my family, you'll be at my house, I'll know your family, and in the end, we'll be lifelong friends.
It's like a big family. We work together and we work hard, but outside of the hospital, we often hang out as well, which I think is a unique advantage to this program. It does offer a nice work-life balance, and being able to have that allows for a stronger relationship between the residents. So Vermont's beautiful. Being in the Burlington area affords you the luxury of spending time downtown, whether that be at the different restaurants that we have or even on the lake. The other advantage is all the outdoors activities that you could do. So I really enjoy it here, and I'm really happy that I moved here.
I live here with my husband and my daughter. It's a safe place to raise a family. We own a home with a nice yard, great school system. There's a lot of things to do outdoors. We really enjoy our free time here.
I have gotten outside to do something every single post-call day thus far in residency. So I've gone backcountry snowboarding with my husband and my dog. Actually, yesterday post-call, I went mountain biking with husband and dog. And stuff like that is how I sort of maintain my personhood. And I think that that's really, really important in residency.
So it's the perfect place.
Seven years is a long time to spend in any place, and I think it's really important to choose a place where you're going to feel welcome and included and part of a comprehensive and positive team. We have a really great group of people here that care about each other, and they care about our training as residents.
I think one of the most important characteristic of this program that leads to good careers in neurosurgery is the interaction that we have with our attendings from an early time period, where by the time you're a chief resident, they know you pretty well. So they know what you need to do to get to a certain program. They're all well connected. They know people across the country, pointing you in the right direction and talking to the right people to get you wherever you need to go.
Well, in comparison with other programs, I would simply point out the consistent success of our residents in obtaining the fellowships which they desire, and their success in clinical practice. Those who have graduated from our system consistently tell us how comfortable they feel doing a broad spectrum of neurosurgery and how well trained they are compared with their colleagues.
The University of Vermont prepared me for a career in pediatric neurosurgery by excellent comprehensive skills in the operating room as well as excellent bedside training. Because the University of Vermont has a small program, we had individualized training and quite a bit of attention from the attendings. This attention, and especially attention to detail, allowed me to complete a pediatric fellowship and has allowed me to succeed as a pediatric neurosurgeon. I had such a lovely experience here because of the fellowship amongst the residents and the attendings that I would actually consider possibly doing it again.
I am often asked by the resident candidates what qualities we are looking for, and the answer is simple. We want the candidate to have as much passion for neurosurgery as we do.